Welcome. My name is Taj, Medicare sales agent, consultant, and advisor, back with another video bridging the gap between the senior demographic and Medicare sales agents. In today's video, we'll be going over additional details pertaining to Medicare supplement plans with a focus on high deductible Medicare supplement plans. I'll review original Medicare, its components and associated costs, along with Medicare supplement plan associated costs to help paint a picture for whom a high deductible plan could be best. If you're unfamiliar with Medicare, I recommend checking out my other video in the top right corner to get some foundational knowledge. Then join me back over here. Without any further ado, let's get into it. So, a Medicare supplement plan, also known as a Medigap, is one secondary Medicare option to provide financial accommodations for a person's hospital and medical care. For a more in-depth description, I recommend checking out my other video in the top right corner of this video. Generally, a person in pursuit of a Medicare supplement plan may go this route because they're looking to keep their medical and hospital expenses comparatively lower than they would be only having original Medicare. This is Part A and Part B. Let me show you what I mean. Okay, what you can expect to be covered under Part A are inpatient hospital stays, the first 3 units of blood, some hours at a skilled nursing facility, some hours of home health care, and hospice care. For 2024, there is a Part A deductible of $1,632 per benefit period. By the way, a benefit period begins the day a person is admitted as an inpatient in the hospital and ends when they haven't had any inpatient hospital care for 60 days in a row. For example, this means if an individual enters the hospital as an inpatient and only needs care for 3 days, then has to go back within the same 60-day allotment the deductible was paid, you do not have to pay the deductible again. Conversely, in the same scenario, if a person re-entered the hospital after the 60-day allotment of time, then it would trigger a new deductible payment of $1,632. Depending on the desired supplement plan of choice, a person could have 50%, 75%, or 100% of this deductible amount covered. Once the deductible is paid, days 1 through 60 as an inpatient are covered by Medicare Part A. Days 61 through 90 as an inpatient will cost $408 per day. Days 91 through 150 as an inpatient will cost $816 per day. After day 150, 100% of out-of-pocket expenses are the responsibility of the beneficiary. Lastly, for a skilled nursing facility stay, there is a $0 charge for the first 20 days and a $204 charge per day for days 21 through 100. The Part A estimated annual cost in a worst case scenario could run someone $77,724 per year. Now, what you can expect to be covered under Part B: inpatient and outpatient medical care, surgical services, mental health care, x-rays and other radiology services, durable medical supplies, and certain drugs only administered in a hospital setting. The Part B deductible for 2024 is $240 every year. All people have to pay this even if they have a Medicare supplement plan. The only exception are for those enrolled in a Medicare Plan F or its high deductible option. The Part B premium is $174.70 every month, and a person can expect to pay 20% of all general medical expenses, as well as any Part B excess charges, which are doctor expenses billed above the Medicare required amount. The Part B estimated annual cost in a worst case scenario is upward of $2,336.40 per year. And the total estimated annual cost of both Part A and Part B is upward of $80,660.40 per year. These costs, albeit in a worst case scenario, are the importance of having secondary Medicare coverage and why some individuals may consider purchasing a Medicare supplement plan. Although the full amounts may not be applicable to all people, they definitely will apply to those who are ill prepared. Okay, now What's a high deductible Medicare supplement plan and the differences between them and other supplement plans? A high deductible Medicare supplement plan is a plan where individuals have to pay a high deductible first before the plan will kick in and help out with medical and hospital costs. Currently, in some states, there are two high deductible Medicare plan options that are Plan F and Plan G. The differences, of course, come from the deductible nature of a high deductible plan and the lack thereof amongst other supplemental plans. Effective January 1st, 2024, the annual deductible amount for the high deductible Plan F and G is $2,800. High deductible plans often have lower premiums than their non deductible counterparts. An important end note here is the high deductible version of Plan F is only available to those who are new to Medicare before January 1st, 2020, meaning if you were 65 years old prior to January 1st, 2020, you qualify to enroll in a high deductible Plan F, and if you turn 65 on or after that date, the high deductible Plan F is unavailable to you. At this point, you might be thinking, which is better, a regular supplement plan or a high deductible supplement plan? As always, I recommend individuals meet with a knowledgeable Medicare sales agent, advisor, and or consultant to review options. Only the person directly involved or assisting the individual directly involved may know what will be best for whom the plan is being purchased. Together, they may accurately and effectively draw up a game plan of possible best solutions. However, some important points to keep in mind are age. Will they be turning 65 or are they older? As this will impact the cost of their monthly premiums. Their health. To estimate the likelihood of regular visits to a variety of doctors and or the frequent or infrequent trips to the hospital or emergency room, which also affects cost. Income also needs to be considered, not only how comfortably they would be able to afford the monthly premiums for their Medicare supplement plan, but to also consider any other services they may need now or in the future, for example, drug, dental, vision, and hearing coverage. Lastly, when considering a high deductible option, there should be contemplation in reference to whether having a lower monthly premium and paying a $2,800 deductible whenever hospital or medical treatment is necessary is more suitable than paying a higher monthly plan premium and no deductible. All right, that's it for now, folks. If you found today's video helpful, help me help you and others by subscribing, liking, and sharing this video. If you have any questions, comments, or concerns, please feel free to leave a comment below and I'll get back to you as soon as I can. Thanks for watching. See you in the next one.